Welcome to the AA Podcast, our little corner of the web where we are not afraid to discuss tough questions like,
when did nutrition, health, movement, and stress management become alternative medicine?
Where we embrace challenges in all aspects of life to become healthier and stronger versions of ourselves.
And where food and movement are the best kinds of medicine, and cooking meals at home is a revolutionary act. Hello, and welcome back to another episode of the AA Podcast. This is Ashley Olson.
And I'm Andrea Crane.
We are so excited about today's
So excited!
episode. But before we get into that and the details, we are going to share our weekly Bible verse, and mine is coming from John 1:14, and it says, "And the Word became flesh and dwelt among us, and we have seen His glory, glory as of the only Son from the Father, full of grace and truth."
Mine is also heralding Christmas. We're going to Jeremiah 23, 5-6. Look, the days are coming. This is the Lord's declaration. When I will raise up a righteous branch for David, he will reign wisely as king and administer justice and righteousness in the land. In his days, Judah will be saved and Israel will dwell securely. This is the name how he shall be called. The Lord is our righteousness.
Amazing. All right, Andrea, we are beyond excited about today's
Mm-hmm.
episode. We have our very first guest, and she is, so I met her through social media on Instagram. As
Mm-hmm.
you may have remembered in a previous episode, I mentioned that I opened up my own studio here in Evergreen, Colorado. And so
Woohoo!
when I did my whole um, Instagram page, it just suggested we be friends. And so we connected. And so I've met her a couple times now. She's come to one of my classes. She
Mm-hmm.
is a real joy, and she has so much information that she's going to be sharing with us today. But her name is Dr. Alyssa Vankeulen, and
Mm-hmm.
she specializes in pelvic floor physical therapy. So, what's so unique and cool about her is that she not only sees people in person, but for our listeners who there's plenty of you that are not in the state of Colorado, but she also does online therapy sessions.
Yeah, and we're gonna
So,
get into how she does that and what that looks like, and I am just beside myself excited.
yeah, I definitely think this is going to bring, hopefully, her, if she enjoyed our conversation at
Yeah,
least,
I know.
hopefully it means that she'll come back and visit with us on another episode because this is something that women truly struggle with.
Mhm.
When we get into it in this episode, but it's kind of becoming a little bit more normalized. But I know probably in my mom's generation and definitely
Mhm.
generations prior, it's something that is embarrassing and not, something that is widely talked about. It kind of goes along with the whole menopause talk too.
Yeah.
And all of that. So she really helps normalize this very personal part of our life,
Mhm.
and really helps break it down into something that's a lot less scary.
Yeah, and ultimately it's there are there's stigma attached to certain geographic regions of the body. There just is. And so those intimate genital areas are something that we don't talk about, and but they are subject to lots of problems. And so we need to be able to have those conversations in order to reach the levels of health and wellness that we deserve to have. So I'm thrilled that we're having this conversation. I do have these conversations in the confines of a treatment room. I have
Hmm.
these conversations with patients, and I know the struggle and the pain that people are experiencing. And I know, it just, I cannot tell you the number of tears that have been shed in my office because of issues like this.
Hmm.
And they've been embarrassed to talk about it, and so somebody like Alyssa can come along and really change somebody's life for the better. So yeah, this is an amazing conversation. She's doing amazing work, and I am so looking forward to meeting her. So and if you and Ashley also put us on video, so I'm real sorry about that, folks. This was not my choice. But
Well, I
This
knew I
is
knew this
yeah,
was gonna be epic, and I wanted to be able to
yeah.
share this with multiple
Mhm.
platforms. So
Yeah, and
appreciate you
Alyssa's
coming from
super
your
cute.
closet.
Alyssa's super cute, and she's not in her closet. She looks like she's in an office. Yeah, so I recorded my closet because it's dark and it's quiet, and this is where like I blow dry my hair and I have like a little desk set up in my closet, and so yeah, I am literally recording from my closet.
Yeah,
So
that's
yeah.
okay.
Mhm.
But without further ado, let's jump in and have our
Yes.
conversation with Alyssa. All right, we are so excited to have Dr. Alyssa Vankeulen. Did I say that correctly?
You did say that correctly.
All
Good
right,
job.
That was
awesome.
really good. I
Um,
like Van
um,
Helsing better, but I'll take it. All right.
you are officially our first guest, which we are honored
Woohoo!
and excited about. But she is somebody that I recently got to know in person, but we met on Instagram, and she is a physical therapist specializing in pelvic floor therapy. Did I say that correctly?
You said that correctly as well.
Okay.
You're on a roll.
Awesome.
Yay.
We'll stop it there so I don't jinx it.
Right,
But
stop now.
yeah, but we're excited to dive deep into pelvic floor therapy. I know this is something that my clients um, deal with or need help with or don't know where to start. So we're gonna get down and dirty with the um, the pelvic
I'm
floor
sorry for
and
her. Yeah.
just kind of dive into what maybe some questions that some common questions, but maybe diving into some that may not be as common, and even finding one, maybe some suggestions of finding a pelvic floor therapist
Mhm.
if you need one in person. But also, just a little shout out. I know we'll do this at the end, but Alyssa does do online. She has clients
I
that she's
have questions about that, Alyssa. I have so many
yes.
questions for you. Yeah, I can't wait.
I got
So
answers.
good.
Awesome.
So we're gonna
Good.
just dive right in. So Alyssa, like, kind of talk to us about your journey. Like, where did it start? What sparked your interest into physical therapy, and then how did that transition into getting super specific with the pelvic floor?
Yeah, so I always knew kind of I wanted to be a physical therapist. I was in high school and I was a dancer growing up, so I've always just loved like movement and was for like medicine and movement and just, overall health and wellness. And so I did like a little internship in high school where I shadowed a physical therapist, really enjoyed that. And then when I went into college, I really loved like my exercise science, kinesiology type studies. And so I kind of just stayed on the track of I know I want to go into like health and wellness, but I really like the physical therapy route because it's more focused on like the movement as medicine versus like the pharmaceutical side of things. And I think functional medicine at that time also wasn't maybe as well known. I feel like nowadays it's getting more and more well known, which is awesome. Um, so then in regards to like pelvic floor, so I went into physical therapy school knowing that I probably wanted to do like orthopedic type rehab, maybe
Mm,
work with dancers because I was a dancer growing up. But then I had a professor there that was a pelvic floor physical therapist. And I talked to her just because I've always loved women's health. I always thought like
mhm.
the reproductive unit in like science class, which is so random, was
Yep.
like the most exciting to learn about.
That's really
Even though
cool. Yeah.
it is really cool. But we spend like 2 minutes on it or like one
Mhm.
hour on it. And so it's just like underlearned about, which kind of is also pelvic floor rehab. It's also just
Mhm.
underserved too. And so I learned a lot from her. And then I loved the aspect of because again, it's something that's not as well known. There's a lot of people out there that need help with it. I thought it was a really cool niche to dive into. And I think it also encapsulated a lot of the like women's health related things in
Mhm.
regards to like hormone health and still that movement piece. So I liked how it kind of combined a lot of the things I'm passionate about into one.
Mhm.
So
That's
And it's
amazing.
also not such a niche population, right? Like I can think of reasons why women would need or referrals that I send, right? For women from, the initial childbearing years all the way up into, geriatric
yeah,
years. And so, yeah, it's a huge need. It's a huge population of patients that you can serve with this kind of knowledge. Yeah, that's great. Um
definitely.
So I had some questions, Alyssa. There are a lot of misconceptions. Oh, also, can we call you Alyssa, or do you prefer
Yes.
Dr. Van Helsing?
No.
Okay,
Please
sorry,
call me
Van Coolen.
Alyssa.
Yeah. Okay. All right. So, yeah, I, I would like for you to take a moment and kind of explain what the pelvic floor is, but then also I want to address some myths and misconceptions about what this therapy is and who it's for, and is it women only, or I don't need this, I've never had a baby, that kind of thing. That
Yeah,
kind of thing.
all the good stuff.
Mhm.
Yeah, so the pelvic floor is essentially a group of muscles that sits at the bottom of your pelvis. So, for example, doing like a Kegel exercise where you're
Mhm.
squeezing the muscles around your urethra, your vaginal opening, and your rectum. When you're squeezing
Mhm.
those muscles, that's you activating your pelvic floor muscles. We can talk more
Mhm.
about Kegels later too, because I know that
Oh,
was
we will.
always
Yes.
a hot topic.
Yep.
But yeah, your pelvic floor is a group of muscles at the bottom of your pelvis that play a role in our stability. So they work with your breathing muscles, your deep abdominal muscles, your back muscles to give you good
Mhm.
spine stability, pelvic organ stability, as well as like hip stability. They also
Mhm.
play a role in our sexual function. So,
Mhm.
for example, like when someone has an orgasm, it's basically your pelvic floor muscles contracting and relaxing. Also,
Mhm.
if people are experiencing pain with intimacy, it's usually due to increased tension in your pelvic floor muscles. So there can
Okay.
be that
Mhm.
tightness as well as
Mhm.
weakness in your pelvic floor. And then they also play
Mhm.
a role in our bladder and our bowel function. So
Yeah.
they keep our sphincters closed and they also open our sphincters when we go to the bathroom. So those are
Yeah.
kind of like the main functions of the pelvic floor and what it is. Um,
Great. Yeah,
yeah,
that's really good. Thank you. And I think so many times people just think about, well, it's vaginal muscle, right? And that's all that it is. And
yep.
it's not. It's so much more than that. So yeah, no, that's a brilliant explanation. And so okay, here's something that I hear all the time. And gosh, it's so ubiquitous that you almost kind of wonder, well, maybe is there some truth to this? Because pelvic floor issues, like this is a relatively, I would say, recent phenomenon in terms of specialty area, right? Um, so I've heard, gosh, probably my whole life that, okay, if you've had a baby, then some level of incontinence is normal. Right? There
Mm-hmm.
is a normal amount of incontinence. And in fact, we're taught, in nursing and medical education um, that there are different types of incontinence and there is a certain degree of normalcy to them. So, in your expert opinion, is incontinence ever a normal state?
Good question. So I would say the global answer being no. However, there's
Okay.
always some exceptions, like you were
Sure.
saying. I mean, if someone just had a baby 2 weeks ago
Oh,
and they
sure.
sneeze and
Mhm.
they pee themselves, right? That
Mhm.
as long as it's not happening consistently, that can be
Mhm.
what we consider normal and we're not worried about it.
Mhm.
However, usually, even if you're, 3 years postpartum, if you had a baby, or if you're going through menopause and you're experiencing more heaviness or leakage, it's more
Mhm.
common to obviously experience those things around those times, just with all of the crazy hormone shifts, all of
Right.
the trauma that your body's experienced with childbirth. But
Mhm.
usually it's due to dysfunction in the pelvic floor, but also the muscles surrounding the pelvic floor. So usually we can get that system to work more effectively so
Okay.
that you're not having those issues, even though, you've had kids or you've gone through menopause. Um,
Mhm.
so
Okay.
And
not
I know
Okay.
normal, I would say overall.
Yep. Okay. I totally agree with that. Yeah. Yeah.
we're gonna probably talk a lot about the female pelvic floor, but kind of go back to Andrew's question, like, is
Yeah.
this a female specific problem or issue, or is it for both female and male?
Yeah. So it can be both. I think
Mhm.
women get a little bit more of the
Side
what's the
effects?
right word? Yeah, the side effects just because childbirth obviously is one of like the main contributing factors to
Mm.
experiencing pelvic floor dysfunction. But I mean, men still have a pelvic floor, so a
Mhm.
lot of times like erectile dysfunction, obviously that's very multifactorial, but pelvic
Mhm.
floor dysfunction can be a component of that. A lot of like older men who maybe are experiencing um, prostate issues if they go through,
Mhm.
like they have to have their prostate removed due to
Yeah.
cancer. That can cause incontinence issues and other things. So I don't have as much experience working with males. I have worked with them in the past, and I've taken a few courses on it,
Mhm.
but it's not my main area of expertise. But yes, they
Yeah.
can experience those issues too.
Okay. Hey, Alyssa, so that actually reminds me of another question that I had for you. What type of education slash certification is there specific to pelvic floor? Like, is there a certification that you can get, or is it more of like an apprenticeship where you learn alongside someone who's been doing this? What does that look like?
Yeah, that's a great question. So in school, we learn kind of like the reproductive unit in like high school. We learn,
Mhm.
one day we have like a 2 hour lecture on the pelvic floor, and it's very brief. But
Yeah.
if you want to practice pelvic floor rehab,
Mhm.
most of the time you have to take a course, and there's a series of courses, but you have to take the
Mm.
first course at least to be able to do more of like a pelvic floor assessment, and do internal
Mhm.
work. And then from there, there's always again like more courses you can go from there.
Okay.
There
So
are
these
some
are
like
like formalized.
exactly, yep,
Okay.
formalized
Mhm.
courses that you take, and then you can, after you've taken a certain number of courses, seen enough patients, you can like take the certification for a pelvic rehab certified
Oh, cool.
practitioner. So
Okay.
there is that option too.
Okay. Oh, wonderful. All right.
Yeah.
Um And so kind of getting into the nitty-gritty here, how would and Ashley, I don't know if you have any specific questions that are specific to men and their journey. We can certainly explore that with her, but most of what I have to ask is about women. That's typically what I see in practice, and I know that's what you see too with
Yeah,
your
I just wanted to clarify for
Mhm.
listeners that like this is not a female specific
Yep.
issue. Like
Yep.
Hmm.
if you are a male that's listening to it and you're like, "Oh, I
Mhm.
had no idea I had a pelvic floor. I thought that was just for my
Right.
female counterparts."
Yeah.
That
Mhm.
maybe if you are experiencing some issues to start looking into it for them. But no, I knew that today's episode was going to be because Alyssa is very much specific in women's health.
Mhm.
So, and we are too, really. I mean, we do
Yeah,
talk about men's health, but most of my clientele is all women. Alyssa's all women. So,
yeah.
and Andrea, I'm sure you see,
The majority of my patients are women, although I have a fair number of men on my panel too, but yeah, this is primarily an issue that I discuss with female patients.
Hmm.
yeah. So, no, I just wanted for the listeners
Mhm.
to, because I honestly, back in the day, I didn't even consider men having a pelvic floor. Like,
Mhm.
it's just something that we always associate with females. So, no,
Yeah.
I
Definitely.
just wanted to let people know
Oh,
that
I like it.
both
So
sides go for it.
yes, yes, we both own them.
Yes.
All right. So what would kind of be a herald sign of you're having issues? Maybe you might need an evaluation, or what might start a woman asking some questions about this?
Yeah. I mean, I think the obvious ones are, leakage. So whether that's, you're peeing yourself with coughing,
Mhm.
laughing, working out, sneezing, lifting
Mhm.
your kids, whatever that may be, or if you're feeling heaviness, or if you notice like a bulge in your vaginal opening, that's
Mhm.
usually more of an indication of could be muscle weakness, or it could even be related to prolapse, which is essentially when one of your pelvic organs has dropped or sitting lower than it's supposed to.
Mhm.
Or if someone's experiencing pain with intimacy, pain with pelvic exams, that's also another good
Mhm.
indicator. But there's also, I would say, some maybe not as well known ones. So things like, if you're experiencing a lot of gas, a lot of bloating,
Mhm.
constipation can also be
Mhm.
related to, again, multifactorial, but related
Yeah.
to pelvic dysfunction, urgency to pee, frequency to pee often, or if you're experiencing
Mhm.
like abdominal pain, hernias is usually another sign of
Yeah.
some degree of like pelvic floor core
Interesting.
function as well. So
Okay.
those are kind of some other ones that are maybe not as well
Yeah.
as commonly talked about too.
Yeah. No, I love that. And I'm just gonna put in the medical caveat here that so many of the things that Alyssa just mentioned also I mean, I can think of, 3 to 5 prominent things on my differential list. If a patient comes and is, has a chief complaint of pelvic congestion, right? Like I start getting a little antsy, like, okay, we got to get some imaging, because that
Mhm.
is a
Mhm.
cardinal sign of potentially some types of reproductive cancers. And so we
Mhm.
really don't want to, we don't want to miss anything that is a diagnosis that needs to be made quickly. And a lot of times in primary care, we do end up with the first complaint that people have, right?
Yeah.
And so I think it's important um, to yeah, take this to primary care. But also I think it's really good when you go into primary care to say, hey, is this something that could benefit from a pelvic floor evaluation?
Yeah.
And then have them refer you over, because I mean, I have lots of women with, upon vaginal exam, you see, like, a prolapsed uterus. You see prolapsed. I see prolapses all the time. And
Mhm.
so the first thing that I do is send them to pelvic floor for an evaluation, because there's so much that can be done. So,
Yeah.
yeah,
Totally.
yeah.
Yeah, and I think,
Um,
like you
mhm.
said, that imaging aspect of, how pelvic congestion can be a big sign of like it's a red flag, right?
Yeah,
And
absolutely.
when
Mhm.
people can determine if their symptoms are related to certain things, I think that's really helpful from a pelvic floor perspective too, to kind of see if it's more movement based and muscle based versus,
Yeah,
like you said, a
yeah,
red flag.
yeah, absolutely. All right. And so, are there some things that people do throughout the course of their lives? Now, our lives look way, way different than they did 30 years ago, right? Like, we're sitting constantly. We Even in my job, I'm on people all the time. Like, we get up, I show people exercises to do. I wall sit with my patients. I want to eventually figure out, how can I do a walking primary care visit? Like, that's my goal, is to get to that someday. But we are sitting constantly and it's infuriating. So
Hmm.
are there things like that we're doing in this modern culture that are contributing to pelvic floor issues?
Yeah, that's another great question. And yes, I would agree that sitting is a big one. I mean,
Mm,
sitting obviously turns off our glute muscles, and our glute
mhm.
muscles sit right on top of the pelvic floor, or they overlay the pelvic floor. And so when
Okay.
we're not using our glutes as much, that usually creates more muscle tension in our glutes, which then
Mhm.
tends to create more pelvic floor tension. And
Hmm.
then pelvic floor tension can obviously contribute to things like leakage, pain, heaviness. And so
Mm,
sitting, I would say, is a big thing. I think
yeah.
also the like drastic change from, we sit for a long time, but then maybe we go do like our hour workout, and the fact that we're not, we're going from like 0 to 100 sometimes,
Yes.
maybe with, because our time is limited, we're not
Yep.
warming up the right way, we're not doing those things, which can also, if we're not getting the right muscles to fire, which pelvic floor, core muscles are a part of our deep muscles. And
Mhm.
usually we want to kind of wake those muscles up first before we start to activate the bigger muscles on top of it. So I would say
Mhm.
sometimes that like 0 to 100 mindset that we have
Yeah.
nowadays is another big thing
So,
for people.
oh yeah, sorry, go ahead.
And then I guess the last thing I was going to say is like stress.
Mhm.
So
Mm,
I feel like, again, our society is very go, go, go. And
mhm.
stress tends to manifest in our bodies. And so that tends to create, again, more tension,
Mhm.
more dysfunction. And so I would say that's another huge thing that we're just not taking care of ourselves enough in today's society. And that
Yeah.
can make things worse too.
Yeah, so, and Alyssa, I'm sorry, this is a little bit off the cuff here, but Ashley and I do a fair bit of talking about the perimenopause and the menopausal
Yeah.
transition. And I I see a lot of this. I do a lot of hormone management in my practice. And so, do you feel, or have you seen that, because when a woman hits that gosh, perimenopause is just nuts. I mean, it can be estrogen dominant, it can be estrogen deficient. I mean, it's just all over the place. But once they hit that true menopausal transition where all the hormones have like landed, right? They have landed and they are not taking off again.
Yeah,
The vaginal atrophy, labial atrophy, the things that contribute to, painful intercourse, to frequent or recurrent UTIs, that kind of thing. Is that something that you're seeing that is contributory to pelvic floor issues as well? Is that in the milieu of what you're seeing?
definitely. Definitely.
Okay.
Yeah, I would say, like you said, with just those hormones not being produced as much as they should be
Mhm.
anymore when someone kind of bottoms out, that
Yeah.
can, like you said, it creates more atrophy of a lot of the tissues down there, including the pelvic
Mhm.
floor. And so
Mhm.
you have less support in that area, and that obviously tends to increase things like pain,
Yeah.
leakage, all of that stuff too. So
Yeah. And
definitely.
okay, and also, I'm so sorry. I'm like dragging you into my practice because I have so many questions for you.
No, these are
But
all great.
I
Maybe
have
this is a
I
two-parter.
I I know, I'm sorry. But I just feel like there are so many things that women have been missing. Like we've been not allowed to have discussions about hormone replacement therapy. Like a whole generation of women got missed when it comes to hormone replacement therapy. And it just makes me want to weep for all of the suffering that has been that could have been avoided. And this is another one of those things that I feel like people deserve to have this discussion. They deserve to have this care. Like this is healthcare. Um, and so I here is a big problem with women, and that menopausal transition again is loss of libido. And so
Hmm.
like I go through I check hormones, and so much of the time like I know that I see their faces and they want help because loss of partner intimacy, that's a huge deal. And so when their testosterone levels that they were sure were bottomed out, when they come back normal and we're sitting there looking at each other and I'm asking, okay, well, is there pain? Is there like how are you mentally? What's going on in your body? What's going on in your mind? Um, is there help for that kind of issue with pelvic floor therapy as well? Is that a referral that I could make when I've checked their hormones? It's not a physiological, issue with regards to hormones.
Hmm. Are you talking in regards to libido, or are you talking more in regards to pain?
Well, see, this is where it gets a little bit complex because I feel personally, and this is just, very, very unscientific, my experience with women, um, I feel like at a certain point, you really can't separate the two because if a woman is experiencing pain, there is a loss of libido that follows that. And sometimes it really takes an in-depth discussion for them to be able to say, well, yes, okay, maybe the genesis of this was that I was experiencing so much pain. And so, no, I was not looking forward to any of this.
Mm.
You
Yeah,
know? So
definitely.
so yeah, so let's just take it from that standpoint. Are there things that a pelvic floor therapist could help with regards to painful intercourse?
Definitely. I mean, kind of like you said, if you're ruling out hormone aspect, which I
Right.
think is something also from a pelvic floor standpoint, if someone's experiencing those things, asking,
Mhm.
have you had your hormones assessed is really
Yep.
important. But
Yeah.
a lot of times, especially if we're talking about perimenopause, menopause, because there's been atrophy in those tissues, atrophied muscles tend to tense up and guard more.
Mm.
And so
Okay.
focusing on things that are focused more on like lengthening pelvic floor is
Mm.
going to allow there to be less tension in those muscles,
Mhm.
which can help with the pain aspect. But like you said, I think there's a huge mental and emotional component to it as well. So having good
Yeah.
discussions with people about, communication with their partner, also things like, I think a big thing that also goes along with the pain and libido is sometimes if people are, having lack of sensation with intercourse,
Yeah.
or they're
Mhm.
having inability to achieve orgasm, which can also be a
Mhm.
pelvic floor symptom. So there's usually a
Okay.
degree of tightness, but there's also a degree of weakness, which is usually because of the tightness that there's
Yeah.
weakness. So,
Yeah.
so
Okay.
yes, I would say that there can be a good like interdisciplinary component
Yeah,
with
I
that
love
too.
that. I love that. No, I just so appreciate this. I'm definitely going to start making more and better use of my resources around here in that
Yeah,
regard. So yeah, thank
that's
you.
awesome.
Um yeah, Ashley, what's next on your list there?
Well, kind of going back to like the exercise and like say somebody's like, well, I just have an hour to work out. I don't have time to do a 15-minute glute warming up, exercise and get my full regimen done.
Mm,
What are some, maybe some things that one as trainers can be mindful of, but even as the trainee, like what are some things that you would recommend to be doing either outside of the gym or something that they could do fairly efficiently once they get to the gym?
Yeah, I love that. I mean, I think even like with working out, I mean, usually like especially like for you at your gym too, like you start to ease into movements. You don't just go right into like, one rep max. But
yeah.
focusing right, no,
Sometimes Ashley's warm-ups are worse than anything that you'll do for the rest of the class. That's my recollection
I
anyway.
love it.
Yeah.
Mm.
Mhm.
But I think the biggest things that people can take away, especially like you said, if they're crunched for time, which is a lot of us in society, and also a lot of
Mhm.
people who are dealing with pelvic floor dysfunction if they have kids or
Mhm.
whatever it may be, their time is of the essence.
Mhm.
And so I would say focusing on like how they're breathing when they're working out. So we talked a little bit about how the diaphragm and your pelvic floor work together. So as we inhale, diaphragm drops downwards and expands, pelvic floor lengthens. As we exhale, the opposite happens. So
Mm,
making sure that people are exhaling on the effortful part of a movement, inhaling on the less effortful part of a movement if they're dealing with
mm.
pelvic floor dysfunction. Of
Oh,
course,
that's good.
there's
Oh.
like your classic, Valsalva maneuver if someone's lifting really heavy, which isn't a bad method, but if
Mhm.
you are dealing with like leakage or heaviness, it's usually not, people usually aren't doing that method the best way. So
Mhm.
focusing on breath work through your movement. And then I would say just making sure people are engaging like their pelvic floor, engaging their core correctly. A
Mhm.
lot of people, when they think about engaging pelvic floor and core, they feel like they need to like brace as hard as they can. And that tends to also do more harm than help. And
Mhm.
so making sure that people are activating like more gently with movement. And then, of course,
Mm.
like building on top of that as, your resistance or your movement becomes more difficult
Mm,
Mhm.
too.
that's awesome.
Yeah,
Um,
I like that.
yeah.
Yeah.
So I would say that's the biggest thing is just making sure that they're doing the right thing when they're doing the things that you're working on.
Mhm.
Yeah, no, that's awesome. So, say somebody is dealing with, especially with like maybe they're not. Well, here's a question: do you find that people who have leakage with exercise tend to also be having leakage with sneezing, coughing, those, or can they be separate?
They can be separate, but also they can go together at the same time. I would say it's easier for someone's leakage with like coughing or sneezing to get better faster versus exercise, just because it's more demand on the body, usually with exercise versus sneezing and coughing. But usually it's due to a deficit in like pressure management. And let me know if I'm getting too much into the weeds, but pressure management means that, again, we have diaphragm, pelvic floor, you have your deep abdominal muscles. So they form like a core canister,
Mhm.
essentially from like your rib cage to your pelvis. And if someone's leaking with coughing or sneezing, there's usually too much pressure going downwards from the diaphragm onto the pelvic floor. And if there's not that good strength in the
Mm.
pelvic area, it can't
Mhm.
sustain that increased pressure. And then that can lead to leakage. And same thing goes with jumping. So if someone's jumping and they're putting a lot of like impact
Yeah.
upwards, pressure downwards, that can lead to leakage as well. But I would say if it's related to exercise, usually there's more to the picture of, there might be deficits in someone's um, glute stability or someone's, core strength. There's usually, I mean, same thing with sneezing and coughing, but usually if it's more related to exercise, there's just more like whole body deficits that need
Mhm.
to be addressed too.
I have several older clients too, and with the older population, it's kind of common that um, they have leakage, right? Um, is that again kind of going back to is that normal, quote unquote normal, or is that something that even as a elderly individual they can get help with?
Yeah, so even again, usually our bodies as we get older, right, aren't as kind to us. So for most people, it can take a little bit longer. Again, kind of like Andrew was saying earlier, making sure that we're addressing hormone health as well is
Mhm.
really important. But yes,
Mhm.
usually there's similar dysfunctions going on in like a younger individual and an older
Mhm.
individual. It just might take a little bit longer for someone who's older versus someone who's younger.
Yeah,
Yeah.
especially as the older population, and I'm talking like my oldest client's 90.
Yeah,
So
Mhm.
she's not she's actually pretty active. She does really awesome, but like the majority of that, 80s, 90s, they're sitting a lot. In front, they're
Mhm.
sitting in their recliner. They
yeah,
might get up to, greet the mailman, but like that glute atrophy, like you were mentioning earlier. Well, you didn't. I don't think you said glute
Yeah.
atrophy, but maybe you did. But that lack of glute strength is
Mhm.
more prominent, definitely, if that's their lifestyle. So,
definitely. Yeah.
mhm.
Yeah, and yeah, friendly neighborhood primary care wing, and make sure they don't have a UTI. Also,
Yeah.
I've seen. Oh man, I have seen UTIs present in elderly women completely different than they present in younger women. So, yeah, that's just the I guess uh, there's terror with UTIs in older women. So if they're
Definitely.
if they're incontinent, we got to figure out why and make sure that it's not like some raging septic UTI. So yeah.
Do you ever see a lot of, or sometimes women that will have UTI, or they'll come in with UTI like symptoms, but
Hmm.
don't actually have a positive
Oh,
culture?
Alyssa, oh my gosh. Okay, this is why we should make this the AAA. Yes, I have so many questions. So I didn't know if we get to this, but thank you for opening the door. So I see quite a bit, like we see because we're functional again, we see some odd stuff, but tons and tons of mast cell activation syndrome. So this is where they're like hyperhistamine all over the body. So we also can see interstitial cystitis. Um,
Mm-hmm.
and so that's where they will have all of these UTI like symptoms. We will culture, we will dip, we will do all the things, and there's nothing there, but yet they are having those very unique, distinct symptoms that a woman will say, oh my gosh, this feels like a UTI. I can't hardly describe it, but it is that weird feeling.
Yep.
Um, and it's the pain, the urgency, the frequency, the yeah, just that weird, like, I tell them it's probably a bladder spasmodic kind of pain. That bladder is spasming, and that's why you get the pain at the end of the urination. And it's terribly painful and weird feeling. So yeah, is that what you're talking about?
Yeah, because I guess, I mean, I've
Mhm.
had experience working with people too that, they've been told, they're not told they have UTIs, but they feel like they have UTI, and then they
Yep.
go, they get it checked, negative
Yeah.
cultures, and it'll happen over and over again. And that can also be sometimes a sign of just pelvic floor
Mm.
hypertonicity or tension. And so a lot
Oh,
of
that's
times
so
those
good.
people will
Okay.
also tend to have more tension, which can put more pressure on the urethra and the bladder
Mhm.
as well. So
Oh my
just
gosh.
interesting to,
Thank you. That's so awesome. That's another tool in my toolkit then, because I can a lot of times we can run their blood work and it's awesome, like if a CBC comes back with eosinophils elevated, then okay, I can be fairly certain that there is some kind of histamine issue going on here. Not always, but again, we've got certain things we can kind of hang our hats on clinically. But yeah, just knowing that that you guys are out there and can help with this, that's tremendous. Yeah, I love collaboration. I think
yes,
that's so critical. Like patients benefit so much when we talk to each other.
yes,
Absolutely. I
exactly.
mean,
It
we can't
does.
all be experts in every field.
No.
No, oh my
Yeah.
gosh,
So,
yeah.
Mhm.
So,
Yeah.
Alyssa, what does a normal physical therapy appointment or maybe even a evaluation look like? And kind of maybe tie that into like what do you
Mhm.
if you do anything different versus in person versus your online?
Yeah, 'cause I'll
Yeah.
tell you something, people won't go to these. They won't
Yeah.
go to these, they are freaked out. What are they
Yeah.
gonna do down there? What they're gonna do, huh? Yeah, so
Yep.
Yep.
yeah.
And I have had people that have seen like previous pelvic floor therapists, and I've seen them before, and they were, like you said, they get a little bit more nervous because sometimes people
Mhm.
aren't, it's not explained to them well what might happen, and then their provider doesn't explain it well, which is really
Yeah.
sad because
Yeah.
then people get really fearful of it. But
Yeah.
usually in an evaluation, and whether it's in person or online, for me, the first thing I do is obviously just chat with them about, what's going
Mhm.
on, get their history, related to medical history,
Mhm.
orthopedic injury type history. And then I always like to do more of like a movement assessment first
Mm.
because the pelvic floor doesn't work by itself. So if we're only looking at the
Mhm.
pelvic floor, we're missing all of the other pieces of the puzzle. So I like to look at, what does their back range of motion look like? What does their squat look like?
Mm.
What does their single leg stability look like? What does their single leg squat look like? Because a lot of
Mhm.
times, what's happening again in their hip muscles, their back muscles, even like what's happening at their knees can tell us a lot about what's happening up the chain in the pelvic area.
Mhm.
Um, and then, of course, looking at range of motion in hips, in back, and then also looking at their breathing because we talked about how diaphragm and pelvic floor work together. So, are they breathing in a way that's um, helping their pelvic floor expand and activate, or are they, only
Oh,
breathing
yeah.
into their belly, only breathing into their chest?
Mhm.
And then also looking at, when they brace their core, are they engaging correctly? Are they overdoing it? Are they
Mhm.
holding their breath? And then I like to really draw a lot of awareness to the pelvic floor, especially with online clients, obviously, because I'm not there to actually feel what's going on in the pelvic floor. So when they engage their core, are they feeling their pelvic floor engage? Like, do they feel a little bit of a Kegel happening when they tighten
Mm.
their abdominal muscles? Because they should work together. When they breathe, do they feel their pelvic floor relax and lengthen? So also just having them understand what should be happening in their body and then kind of bringing that awareness there. So
Mhm.
that's like the big kind of like first piece I always do. And then, of
Mhm.
course, there's always the dreadful pelvic floor muscle assessment that I do with in person clients, right? And that's what
Mhm.
a lot of more people get more fearful of. So with a pelvic floor assessment, again, I always like to walk through. I have my pelvic model and I'll show them like this is exactly what we're doing.
Oh,
Because I
good.
think
Uh-huh.
them conceptually
Mhm.
understanding, what we're feeling and why we're doing what we're doing is really helpful for them and
Yeah.
obviously for me, for them to just feel more
Mhm.
comfortable with it. And so with a pelvic floor muscle assessment, essentially what they do is just undress from the waist down and then I'll put like a blanket over
Mhm.
their pelvic area. And the first thing that we do is just kind of observe externally, like when they do a Kegel, do we actually see the vulva and the labia move upwards?
Mhm.
When they bear down, does everything move downwards? And
Mhm.
then feeling externally with a gloved hand, if they feel any like tenderness or tension in any of the tissue externally.
Mhm.
And then from there, if they're comfortable with it, we'll do an internal assessment and it's just gloved hand, one finger assessment. And what we're feeling for is the muscle, like
Mhm.
tension, or we're feeling for the strength and just the integrity of the muscles. So since the muscles go all the way around, they're like a
Mhm.
360 degrees of muscles through there, and there's different layers of those muscles. We have to feel in different areas. So we'll start in one area, and then kind of
Mhm.
go around like a clock and just feel for that like muscle tension or any
Mhm.
discomfort that anyone's feeling. And then from there, we'll see, when they do a Kegel, are they activating correctly? When they
Mhm.
bear down, can they relax those muscles? Then also looking at their breathing again, kind of seeing when they breathe, what does their pelvic floor do? When they brace their
Mhm.
core, what does their pelvic floor do? And then also, if we need to, we can assess for prolapse as well. So
Mhm.
same thing. We have one finger inserted and we're just gently putting pressure in one area as they bear down to see if we
Mm.
see any bulging of any
Yeah.
tissue. And then sometimes too, if people aren't symptomatic laying down, which is common with prolapse, we'll do like prolapse assessment in standing too. So we can always do that
Oh.
standing up
Mm-hmm.
just to kind of get a bigger picture. So
Mm-hmm.
that's what a pelvic floor muscle assessment looks like. It's usually relatively pretty quick, I would say.
Mm-hmm.
But it's one of those things that doesn't have to be done if someone's not comfortable with it. There's still a lot of really good information we can gain from just a
Mm.
movement assessment or just an external assessment too.
Okay. And so do you guys use tools like, I mean, I'm trying to think what this would be akin to. Do you use tools that might be similar to like a transvaginal ultrasound, right? You know how
Hmm.
they'll get imaging. I will often get vaginal or uterine or ovarian imaging via a transvaginal ultrasound where, instead of just running the ultrasound over the lower pelvic region, they instead insert an ultrasound device vaginally, and then we get, incredible uterine data that way. It's actually better than going transabdominal. Um, so do you use equipment like that? I mean, is that a good way to describe it to people who that I'm trying to get to go and have this evaluation? Well, like it doesn't sound any worse than a PAP, right?
Yeah. I would say, like, usually with like a pap smear and things like that, if you're ever using like a speculum or any of that, we don't
Mhm.
use any of that. So it's
Yeah.
usually
Yeah.
not uncomfortable in a way that it shouldn't be painful, but it's
Right.
more so uncomfortable for people just in the fact that it's obviously personal for a
Of
lot of people.
course. Mhm.
Um, but in regards to the ultrasound, I personally have never used those, but I have had some like colleagues that have used them
Mhm.
at their clinics. So some clinics have
Okay.
access to ultrasound machines and they'll use
Uh-huh.
them. But I would say
Okay.
it's probably less common than more
Okay.
common.
Okay. And then also, there's, a lot of talk in medical spaces, and I think for good reason, about, this idea of trauma-informed care, because there are so many women who have,
Hmm.
sexual assault in their history. And so is there any kind of discussion or questions that you have about that? And what does that look like?
Yeah. On my intake form for my practice, at least, I have a question on there that asks if they've experienced any
Mhm. Mhm.
trauma, and they can either say like yes, no, or I prefer to discuss this in person. And so
Okay.
that
Yeah.
kind of allows me to, I don't know, it opens up the door for that
Yeah.
conversation.
Yep.
But
Exactly.
usually when I'm walking through the pelvic floor assessment, I'm always again making sure
Mhm.
that they're comfortable with it, asking
Yeah.
them, and I tell them, at any point during the assessment, if you want to
Mhm.
stop, let me know and we can stop right away. So I think
Yeah.
giving them the control,
Yep.
but there's
Absolutely.
definitely, like you said, a lot of discussion around the trauma informed care
Mhm.
in our world too.
Yeah. And I feel like, you know, again, just my personal experience, but I feel like if the patient knows that I know what her history has been, and also what I'm doing and what you're doing is so clinically focused. I mean, it almost like takes the physical personal out of it,
Yeah.
but then you do also have that emotional connection with this person, and you can treat them with compassion and understand where they've been. And I'm never going to do anything to hurt you further. I'm just you know doing something clinically to evaluate something that could be potentially wrong. So yeah, it sounds like
Definitely.
that's very similar to what you're engaged in too, because it's a very personal kind of business.
Yeah.
um so I wanted to ask you, when they are talking about, and I confess this to you before the interview started. I have told women to go and get a diva cup, like if they're leaking and they cannot get into pelvic floor soon enough and it's just becoming really problematic, like I will tell them go and buy a silicone menstrual cup, and use that, because that that can work. It's a Band-Aid solution, right? Like a lot of our medical interventions tend to be,
Yeah.
but it can work. It can get them through until they can get in to see you. So when they come in, what kinds of things? I mean, I know it's more than Kegels, because people will say, "Oh, I've done a million Kegels and they don't work," right?
Yep.
So
Exactly.
yeah, what do your therapies look like? I know it's completely individual, but what could some of the possibilities be?
Yeah, so I mean, for me, the things I like to focus on first are making sure that people are, breathing correctly, they're engaging deep core correctly, so like their
Mhm.
abdominals correctly, engaging pelvic floor, which partially is, I don't want to say a Kegel, but in the sense of like
Mhm.
when you engage your deep abdominals, if your pelvic floor is coordinating correctly with
Yeah.
your abdominal muscles, they should turn on together. So making sure
Oh,
that
okay.
that system is working together. If it's not, then we need
Mhm.
to make sure that we're training those muscles to activate together through essentially just core activation type exercises.
Yeah.
And then, I mean, of course, from there, then adding on movement. So once you get the coordination down, we're focusing
Mhm.
on, building that strength in your glutes, building that strength in your core, building
Mm.
that strength or mobility through your backs and your hips, just kind of
Uh-huh.
depending again on like what they need. But a lot of
Yeah.
times people will be given like exercises laying on their back to start, which
Mm.
is, I think, a good way to start just to make sure that they're coordinating things correctly, doing it the right way. But a
Mhm.
lot of times, unfortunately, in pelvic rehab, whether it's for insurance reasons, they run out of visits, or whether it's just, I don't know, lack of challenge for people, is
Mhm.
people will kind of stop at doing the laying
Yeah.
down exercises and they won't progress to doing
I
more
see.
type
Yeah.
movement. So that's
Yeah.
one thing I really focus on, is making sure that we're getting to a point where we're getting them standing. We're doing jumping things if they're leaking with jumping, or
Mm.
they're doing heaviness. We're doing heavier lifting, but we're still addressing those same coordination concepts within
Yeah.
the exercises we're doing. So just kind of continuously building on top
Mhm.
of the exercises that they're doing, but making sure that we're addressing the dysfunctions. Kind of, if we go
Yeah.
back to whether it's coordination, whether it's hip stability, probably a combination of a lot of things, making sure that we're continuously addressing those just in different ways that are challenging them as time goes on too.
Mhm.
How important
Mhm.
is jumping? And I'm specifically thinking like there seems to be a new or occurring movement of the rebounder, or
I
even like
want
those.
one so bad. Am I old enough to have a rebounder? Is that
I
okay?
think so.
Okay. I
So
want one
you know,
so bad.
there's that,
That
and
looks
then the
yeah.
new thing now is like the vibration plates where you stand on
Uh-huh.
them.
Yeah.
So like, how does that translate, or does it, with the pelvic floor?
Yeah, I actually had this good conversation with a client the other week about rebounders and pelvic floor issues. And I mean, it's one of those things, if you're symptomatic when you're standing on there, right, you want to be mindful of how you're doing it. But if we can train your body to do or use the equipment in a way that you're not having symptoms,
Mm.
then you can obviously still use it. However, I don't know the research behind it. I haven't looked into it, but I've heard from some people that I've like worked with that they've used the rebounder, and over time, again, if they're doing it correctly, it can
Mhm.
actually teach their pelvic floor to rebound in a way in a better response so
Hmm.
that
Hmm.
they're having less leaking with that stuff too. So it can be a really good
Wow.
tool to use, again, if they're doing it the right way.
I just
Makes
think they
sense
look
to me.
super fun.
Yeah,
Well,
Just
they
and
do look fun.
a lot of people on on the grams, they're like, it's great for the lymphatics, which I'm sure it
Yeah.
is. Great for stress, like you're kind of whatever. Um, so I don't have
mm,
one,
Yeah.
but
yeah.
yeah. Anyway,
They are everywhere.
um,
Yeah, I love them.
so what is, we're talking about, okay, I leak a little bit when I cough, or okay, when I lift heavy deadlifts, I might leak a little bit. Well, what's the problem with that? Like, what
Mhm.
why should I be concerned with those, what I would say, quote unquote, are minuscule issues?
Hmm. Yeah, so a lot of times when those types of things are happening, right, it's usually due to something going on in your body. So obviously there's probably pelvic floor dysfunction, but there's also probably dysfunction in again, depending on what's happening in your breathing pattern, in your glute function, in maybe even like what's happening in your feet when you're lifting. And so it's usually just a sign of a bigger issue going on.
Mm.
And so it's kind of like, if you don't address it now, then over time it could get worse, whether that's the
Mhm.
leakage getting worse or whether that's another injury appearing, just
Mm.
because it's, again, usually some type of dysfunction, your whole body that's causing that. So yeah,
Yeah.
I do get that a lot too. It's that, why does it
Mhm.
matter type of mentality, which obviously you kind of have to weigh of, what's important for
Mhm.
someone to address versus not. But I think if someone wants to be proactive about it, that it can be a really good thing to just
Yeah.
address, because the sooner you address it, also the faster it'll probably get better too, rather than
Yeah.
waiting.
Yeah,
Yeah.
absolutely.
Yeah.
So, there's probably a lot of new moms that are listening, or maybe
Mhm.
not even new moms. Maybe there's just moms that have like
Mhm.
5
Old
10 year
moms.
olds,
Mhm.
and yeah, old moms.
Mhm.
What
Mhm.
advice do you have for postpartum women to rebuild that strength in their pelvic floor? So, you mentioned earlier maybe that first week or two, it's kind of normal to have that leakage, but at what point should that kind of stop? And then how do you
Mm.
be proactive in strengthening your
Hmm.
pelvic floor going forward? And how does I always say it incorrectly, maybe I can get it done today, but diastasis recti, how does that play a
Mm.
role with the pelvic floor?
Yeah. Oh, good question. So I think trying to remember the first question. Oh yeah, how can people be proactive, right? You said?
Yeah. Hmm.
Yeah. And so, I mean, there's a lot of ways people can be proactive even during pregnancy. So I do a lot of work with women who want to like prep their body for labor and delivery in regards
Mhm.
to like pelvic floor core type, like rehab or prehab, if you will. And so we'll
Mm.
do a lot of work on, for example, when you're giving birth, your pelvic floor essentially needs to get out of the way so that your uterus can push your baby out. And so doing a lot of like lengthening, focusing on proper breathing strategies, focusing on positioning during labor so we can prevent tearing, we can prevent prolapse, things like that. So, from a
Mhm.
proactive standpoint, that can be really beneficial. But then, if we're talking about recovery, I think there's this, you know, timeline, right? You have that 6 week appointment with your doctor, but then there's kind of this like lull between 0 and 6 weeks, and a lot of people are just trying to survive in that time period, which is step one. That's what you should focus on. But I also get a lot of people that want to just kind of like start doing something. They're like, I feel like I need to
Mhm.
start moving my body in some way, and how do I do it in a safe way? So, starting with a lot of those foundational things like breathing, core activation, and then you can slowly progress those types of movements or do some gentle exercise, as long as you're not noticing any increase in things like
Mm.
leakage or heaviness or bleeding, because that can be a sign that your body's doing too much. So it's always really awesome to work with women kind of through that 0 to 6 week timeline, because they just don't get a lot of guidance
Mhm. I
throughout that time.
agree.
So
Yeah.
that's always a time where obviously you have to wait for any internal type of assessment from a pelvic floor therapist
Mhm.
after the 6 weeks, but you can still also see a pelvic floor therapist or work
Hmm.
with someone before then if you're experiencing those things, or if you just want to start healing your body kind of in the best way
Mhm.
before that timeline.
I love
Um,
that. I love that. So
yeah.
when you're talking about doing evaluations in that 6 weeks, or let's just expand it. Like, let's talk about your evaluations in general and the stuff that you're doing online. I think that is so amazing, making it accessible to people. Do you find that insurance is willing to play ball with online PT? How have you found those relationships? Do you take insurance in your practice?
I do not take insurance in my
Okay.
practice.
Okay.
I am in the online space, so I
Mhm.
am online. I'm technically like an online pelvic health coach, because that
Oh,
allows
sure,
me
because the
to.
licensure across state lines and so forth. Yeah.
Exactly. So it just
Mhm.
allows me to see more people everywhere.
Yeah.
But in person, I also don't work with insurance, just because, I mean, I'm sure you guys know, right? The
Oh,
limitations, unfortunately, of insurance.
yep, I
Um,
do. Yep.
which is sad, because I agree, like the accessibility to it
Mhm.
is really important, right? But
Yeah.
I've worked in insurance based clinics before and just having less time with people is really hard, not being able to get them in as frequently because you're just overloaded with more
Mm,
people. And so I found that it's just such a better balance for me and
yeah.
balance for my clients when I'm
Yep.
doing it without insurance.
Yep. I
But
I could not agree more. Yeah, I work in an insurance model, and it's hard. It's
yeah,
really hard to balance what we do. So, yeah, I completely get that. Um,
definitely.
so, we've kind of talked at length about some of the challenges that you have encountered. Are there any other challenges that just in getting people in the door? And I think so much of it is just, again, it's a very personal kind of thing, you know. I do feel like as a society and just women in general, we're starting to get to that place where, okay, we can have conversations, right? That we didn't feel comfortable having before. Are there any other challenges that you found in just getting women to, avail themselves of this help?
Yeah, I mean, I think you pointed out one of the biggest ones for sure. It's one of those things that's more personal. People maybe get a little bit more embarrassed to
Yeah,
be in that
sure.
situation. But like you said, I think we're doing a better job in society of normalizing it in the sense of
Mhm.
like people should get help for it. But
Mhm.
other things that I find that I guess are barriers are like childcare. So especially this time of year,
Yeah.
people are
Mhm.
sick, right? So
Yeah.
if they have an appointment, it's just hard to get to. They don't know what
Yeah.
they're going to do, for childcare. They have to bring their kid to the appointment, and it's just straight chaos the whole time.
Yeah,
Um,
boy, you're right. Yeah, because it's different. You have to disrobe. It's not like you're coming in for, a strep throat check. This
yeah,
is completely different. Yeah, you're right. That's a
exactly. And I
that's a
think
barrier.
yeah,
Mhm.
definitely. That's a huge barrier for a lot of people. And that's why I've also found that the online space has been really helpful for people
Mm,
because they're able to find the time
yep.
that makes sense for them, like during nap time, and they don't have to find
Yeah.
childcare or, toggle with schedules because that can be really hard.
Mhm.
But I think the other big one is just that there's a lack of pelvic floor therapists out there.
Yeah.
And so, like you were saying, Andrea, I think that you have people in your area, but it's just really hard
Yeah, they're
to get
they're
people there.
booked.
Yeah,
Booked. Yeah.
yeah.
Okay.
So there's just a lack of, I would say, providers out there. And I think the other barrier is insurance too. Like I said
Mhm.
earlier, when people start to maybe get a little bit better, but they're not better enough, or they're not getting better
Yeah.
for some specific reason, and we can't progress them in a proper way, we're kind of
Mhm.
stopping before they're fully better. So then they say that pelvic floor doesn't work, but
Right.
really they probably just didn't have the right
Yeah.
progression of care. They weren't focusing on the right things too. So,
Yeah.
yeah.
What kind of expectation should somebody have going to see a pelvic floor specialist in terms of how many visits on average
That's a
should
good
should
question.
they
Hmm.
should they expect to have
Hmm.
with you?
Yeah, I would say, I mean, my kind of like normal regimen is I like to work with someone for 3 months. So, like 12 weeks. That doesn't mean we're
Mhm.
seeing each other every single week, especially if it's in person. But I think that gives people a really good time to focus on that like coordination aspect. But then also, we get a really good amount of chunk of time to focus on the strength aspect. But I would say most people, I would expect them to see improvements in their symptoms for sure within 2 to 4 visits.
Okay.
Obviously, not full symptom resolution, but they should notice changes
Hmm.
for
Awesome.
sure.
Yeah.
Yeah,
Yeah.
that's
Kind of
great.
also helps like people like, okay, if I'm paying cash for something, help
Yeah.
budget like
Mhm.
some expectations there.
Yeah.
Um,
Definitely.
Well,
it,
I was wondering, what should so when people are looking for a pelvic floor therapist, right? I mean,
mhm.
if they're lucky enough to be in an area that's got, you know, several people. I know that Denver Metro is fairly big. I live in the biggest
Yeah.
part of Idaho, so we do have some options here. Not enough, but we do have some options here. What should people be looking for? Like, should they be asking some specific questions? Like, should they be looking for a specific certification, or what does that look like when you're trying to find someone to work with?
Yeah. I mean, I think first step is, I mean, depends because not everyone obviously kind of advertises what all their
Right.
certifications are. But I think for sure them taking some degree of pelvic rehab
Mhm.
continuing education, which usually if people have done some of that
Yeah.
work, it'll be listed. So definitely, I mean, there are people out there who will say they treat pelvic floor, but they've never maybe taken a course before. So I think
Yep.
that's definitely a necessity.
Yeah.
For people. And then I would say the other biggest thing, which is really hard to determine in like before you go to your appointment, but if you go to your appointment and they are only doing an internal assessment and they're only telling you to do Kegels, I would say that's probably not the best pelvic rehab provider because they're not looking at the whole picture.
Yeah.
You definitely want someone who's going to be kind of assessing more of you and really getting to know you a little bit more versus just focusing on the pelvic floor itself too.
Yeah.
I
More
think
that
that's
full body.
Yeah. I think that's so good. And you know what? We see that in functional medicine too. Like there are, I'm embarrassed to say, but there are weekend classes that people are taking and then they're going and hanging a functional medicine shingle and it's like, wow. So yeah, there's a lot to this, and I know that this is a burgeoning area, and it's an area that's got a real uptick in interest from the public, and so with that comes these gosh, I call them corrupt efficiencies, because they just crank out people that say they do this or that, and really it can detract from the work that we're all trying to do,
Definitely.
So yeah, no, those are great hints for people. Thank you.
And I think it's one of those things that's always hard because obviously when I started out, and I had some really good mentors when I was in school for this area, so that was really helpful. But when I started out, I was still doing a movement assessment, but now so much more of my assessment is less focused on like the pelvic floor itself and more focused on so many other things. So I think it's also right. We live and learn as practitioners.
Of course.
And we're always growing and learning. So I think it's hard to differentiate that for sure.
Yeah.
That's amazing.
Yeah.
Alyssa, this has been incredible.
Yeah.
I think we've touched on so many common issues and signs that women are dealing with. And so if people are like, after listening to this episode, oh my gosh, I think I need to maybe
I need
visit.
to work with her. Yes.
Yeah, I need to see Alyssa. Where can they find you? What's the best way to contact you? And we'll make sure to get this information in the show notes as well.
Yeah, no, this has been amazing. Thanks for having me.
Yeah.
But I mean, the best place to find me is on Instagram. I have a website as well. So you can always inquire on my website and book I always do a free consult for people, whether it's in person or online, just to kind of make sure that it's a good fit and to understand, to make sure that it's something I can actually help you with. And then Instagram, I'm pretty active on there. So you can obviously ask me any questions that you have on there, if anything pops up too.
What's your handle?
Yeah.
My handle on Instagram is Doc, so DOC Alyssa, and then VK.
Okay.
Yeah. And then my website is pelvicwellnessco.com.
Awesome.
Okay. Great.
Yeah, she's super active on Instagram, has amazing videos, exercises that you guys can start incorporating today. But definitely if you have any inkling of thought that you might need to see a pelvic floor specialist, I highly recommend reaching out to Alyssa. She's amazing. So thanks for taking the time today.
Thank you so much.
Yeah. And hopefully we'll all see you around the area, but hopefully we might be able to chat again on another episode.
That would be awesome.
All right. Thank you so much.
Thanks, Alyssa.
Yes, thanks, guys.
Bye-bye.
Bye.
The content provided in the AA podcast is intended for informational and educational purposes only. The podcast is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The information and opinions expressed in this podcast are solely those of the individuals involved and do not constitute medical advice.